I've spent over 20 years treating men over 50, and I've seen it again and again. Fatigue, belly fat, low drive, poor sleep, brain fog, and one root issue underneath it all: low testosterone. But here's the shocking part. For many of these men, the problem isn't age. It's habits. Quiet, daily choices that slowly drain your testosterone without you even noticing. No one talks about them. Your doctor may not even ask about them. But they matter, and they add up fast. I've seen men regain their energy, motivation, and confidence without pills, simply by fixing these hidden testosterone killers. In this video, I'll walk you through 7 of the most common clinically backed habits that are silently lowering your testosterone every single day, and what to do instead. Some of them may surprise you. Some may feel harmless. But if you care about staying strong, clear-headed, and vital, especially after 50, this could be one of the most important videos you watch. Let's start with the most common one I see in my male patients. And most don't even realize it's doing damage. Habit number 1. Poor sleep. The fastest way to kill testosterone. If there's one thing I see consistently in men with low testosterone, it's sleep issues, and most don't realize the damage it's doing. Testosterone isn't just produced when you're awake. In fact, the majority of daily testosterone production happens at night, specifically during deep, uninterrupted sleep. If your sleep is short, broken, or irregular, your testosterone levels can drop significantly in just a few days. I've treated men who were otherwise healthy, eating decently, staying active, but they were sleeping only 5 to 6 hours a night. Their energy was tanking, libido was low, and motivation gone. We ran labs, and sure enough, their testosterone was well below normal for their age. A large study published in the Journal of the American Medical Association found that even 1 week of restricted sleep, just 5 hours per night, led to a 10 to 15% drop in testosterone in healthy young men. Imagine what that does over months or years. Here's the problem. Many older men think poor sleep is just part of aging. And while sleep patterns do change with age, it's not something you have to accept. If you're serious about protecting your testosterone levels, sleep must be a priority. That means aiming for 7 to 8 hours of consistent, good quality sleep, in a dark, cool, quiet room. Avoid screens an hour before bed. Cut caffeine after noon. Create a consistent bedtime routine. These small shifts can trigger huge hormonal changes. And I always tell my patients this: if you fix your sleep, your hormones will often fix themselves. Let's move on to habit number 2. One that's hiding in almost every kitchen, and quietly wrecking male hormones every day. Habit number 2. Seed oils and ultra-processed fats, silent hormone killers. You probably don't think much about what oil your food is cooked in. But in my clinic, this is one of the first things I look at when a man comes in with signs of low testosterone. Because these so-called heart-healthy oils, canola, soybean, corn oil, sunflower oil, they're everywhere. And they're high in omega-6 fats, which in large amounts can increase inflammation, disrupt hormone production, and lower testosterone over time. Let me tell you about Gary, a 67-year-old patient of mine. He wasn't overweight, he walked every day, but he said he just didn't feel like a man anymore. No drive. No strength. He'd written it off as aging. When we looked at his diet, almost every meal involved processed foods, boxed dinners, dressings, roasted nuts and vegetable oil, even healthy frozen meals. He thought he was eating light, but his hormone panel told a different story. Gary's testosterone levels were 30% below the normal range. We cut out the seed oils and ultra-processed fats. Switched to olive oil, avocado, and the natural fats you find in eggs, salmon, and a bit of grass-fed butter. Nothing extreme, just back to basics. Within 2 months, Gary told me, I wake up feeling like I did 20 years ago. His levels were still low but moving up naturally, and most importantly, he felt it. Here's the key: your hormones are made from fat. But the right fat. Ultra-processed oils damage your cells and confuse your body's hormonal signals. If you want to support testosterone after 60, don't just look at sugar or carbs. Look at the oils you're using. Because what you cook your food in might be the very thing killing your drive. Next, we'll talk about a habit that hides in plain sight, and it's probably on your kitchen table right now. Habit number 3, daily alcohol, a testosterone saboteur in disguise. I had a conversation recently with a good friend of mine, early 70s, sharp guy, still active. He said to me, half joking, I'm starting to feel a little slower lately, maybe I just need a vacation. Or maybe less wine. I looked at him and said, if you want to keep your testosterone, it might be the wine. Here's why. Regular alcohol intake quietly chips away at testosterone levels. It doesn't take heavy drinking. Just a few drinks a week, done consistently over time, can have a noticeable effect on your hormones. It's subtle at first, but it builds. Your liver is key in hormone regulation. Alcohol stresses the liver and increases the activity of an enzyme called aromatase. That enzyme actually converts testosterone into estrogen. So yes, that evening drink you think is harmless may literally be lowering your testosterone and raising your estrogen. And it gets worse. Many older men rely on alcohol to relax or fall asleep, but alcohol actually disrupts deep sleep, the exact window where most testosterone is produced. So you're hitting your hormones from both sides, reducing production and increasing breakdown. What I advise, whether you're a patient, a friend, or a family member, is this: scale it back. See what happens. Try staying under 7 drinks a week. Take a few nights off entirely. And better yet, give your body a full 2-week break. Most men are shocked by how quickly their sleep improves, their energy returns, and their motivation comes back. You don't have to become a monk. You just have to give your body a fighting chance to rebalance. Now let's move on to habit number 4. Something many men do all day long without thinking, and it's quietly sabotaging testosterone from the inside out. Habit number 4. Sitting all day, the hormonal slow death. In every hospital and clinic I've worked in, I can spot it instantly: men who've become too sedentary. And it's not always because they're unmotivated. Sometimes it's retirement. Sometimes it's joint pain. Sometimes it's just routine. But over time, one thing becomes clear: the less you move, the faster testosterone slips away. Your body was designed to move: walk, lift, stretch, push, pull. Movement isn't just good for muscles. It's a hormonal switch. When you move, especially through resistance or full body activity, you activate signals that tell your body to produce more testosterone and less cortisol, your stress hormone. But when you sit all day, every day, that signal turns off. There's also a blood flow issue. Sitting for long stretches, especially with poor posture, reduces circulation to your lower body and pelvic area, areas directly tied to male hormonal health and function. Over time, poor circulation means poor nutrient delivery, more inflammation, and yes, reduced testosterone. And no, an hour of exercise doesn't erase 8 hours of sitting. I always tell patients, it's not just about the gym, it's about your daily baseline. Are you getting up every hour? Are you walking after meals? Are you avoiding that passive low-energy state for too long? Even short bursts of movement help. A walk around the block, standing while on the phone, stretching during commercials. These tiny efforts add up, and more importantly, they wake up your hormonal system. I've seen men boost testosterone, energy, and even libido just by changing their movement habits, without touching a weight. Movement is natural medicine. And it's free. Next, let's talk about habit number 5, and this one hides behind a screen. Something you might be doing every day without realizing the toll it's taking on your hormones. Habit number 5. Constant screen time, and its silent effect on hormones. This one surprises a lot of my patients. Most men don't connect their phone, tablet, or TV time to their hormones, but the connection is real, and it's stronger than you might think. Every day in the hospital, I see older men glued to screens, waiting rooms, recovery beds, even during meals. It's become a default habit. But here's the problem. Too much screen time leads to low movement, poor posture, reduced sunlight exposure, and overstimulation of the brain. All of these interfere with healthy testosterone production. One major issue is blue light. The kind that comes off screens, especially in the evening. It disrupts melatonin, your sleep hormone. And as we've discussed, when sleep goes down, so does testosterone. I always tell men, if you're staring at your phone before bed, you're telling your brain to stay awake, and telling your body to stop making testosterone. But beyond the light itself, screen time changes behavior. It reduces activity. It increases snacking. It encourages passivity. Instead of doing something physical, social, or mentally challenging, all of which support testosterone, you're scrolling or watching. Even emotionally, constant exposure to stressful news or overstimulating content can raise cortisol, your stress hormone, which suppresses testosterone in a direct, measurable way. When I talk to men about this, I don't say cut screens entirely. That's not realistic. What I do recommend is this: create screen-free windows. 1 hour in the morning. 1 hour before bed. And at least 30 minutes midday where you intentionally move, go outside, or read something on paper. Your testosterone responds to rhythm, recovery, and calm stimulation, not the chaos of endless notifications and flashing headlines. Now let's move on to habit number 6. This one looks healthy on the surface, but it's fooling a lot of men, especially after 60. Bonus tip: what about masturbation? The truth for men over 60. This is a question that comes up more often than you'd think. and most men are a little hesitant to ask. But let's talk about it openly because it's relevant. Does masturbation affect testosterone? The short answer is, not directly and not in the way most people assume. In clinical studies, occasional ejaculation, whether from sex or masturbation, does not lead to a long-term drop in testosterone. In fact, regular sexual activity has been shown to support hormonal balance, improve circulation, reduce stress, and even help with sleep. That said, like with anything, frequency and context matter. What I often see in older male patients is not just the act of masturbation itself, but the pattern that comes with it. Staying up late, excessive screen use, poor sleep, shame, lack of real connection. When it becomes compulsive or tied to boredom, stress, or digital overstimulation, that's when it may indirectly affect testosterone, by interfering with sleep, raising cortisol, and draining mental energy. I tell my patients this: masturbation in moderation, done without guilt or obsession, is not harmful. In some cases, it may even be beneficial, helping maintain healthy blood flow and function. But when it becomes a daily escape, especially late at night with screens and poor sleep, that's when it starts to interfere with your hormonal rhythm. So ask yourself, does it leave you feeling relaxed and balanced, or depleted and ashamed? The goal isn't perfection, it's awareness. If your energy, drive, and focus are suffering, this is one area worth reflecting on. At the end of the day, testosterone isn't just about sex. It's about vitality, purpose, and rhythm. And everything you do, including your most private habits, plays a role in that. Tools.